Hello, and welcome to the third Pharmacy 15. This week we will cover two endocrine-related drugs and an adjunct medication used mostly during lymphoscintigraphy. The two endocrine-related drugs are Lugol solution and recombinant human thyroid stimulating hormone, TSH, which goes by the brand name of Thyrogen. Then we will discuss lidocaine or lidocaine EMLA cream. So let's start with Lugol solution and a little history. Lugol solution is an iodine solution named after the French physician Jean-Guillaume Auguste Lugol. It was first made in 1829. Lugol solution is widely used as an antiseptic and disinfectant, such as to disinfect drinking water in an emergency. It can also be used to treat thyrotoxicosis until surgery can be carried out. We use Lugol solution and other iodine compounds to protect the thyroid gland during nuclear medicine procedures using radioactive iodine. The most common procedures are DAT scan imaging, where I-123 ioflupane binds to dopamine transporters in the brain to diagnose Parkinson's disease, and I-123 or I-131 MIBG, and I'll try and say it, meta-iodobenzoguanidine, that is used to diagnose neuroendocrine tumors. To be clear, Lugol's is not the only thyroid protective agent. We can also use supersaturated potassium iodide, or SSKI, potassium perchlorate, or sodium perchlorate. The difference between Lugol's and SSKI is that Lugol's is a mixture of potassium iodide and elemental iodine, whereas SSKI is a highly concentrated solution of only potassium iodide. Perchlorate, whether potassium or sodium, also acts as a competitive inhibitor of iodine uptake in the thyroid gland and attenuates the production of thyroid hormone. These drugs were used to treat hyperthyroidism in the 1950s and 60s, but this practice ceased due to the high incidence of aplastic anemia and nephrotic syndrome. Lugol solution, SSKI, and the other agents work through a mass effect mechanism where the thyroid is flooded or saturated with non-radioactive iodine, which significantly reduces the gland's ability to absorb radioactive iodine. The protective effect reduces radioactive thyroid uptake to about 2 to 4%, depending on the literature you read. And we all know I read the literature. Any iodine not taken up by the thyroid is excreted in the urine within days. There are complicated mass effect pathways that I don't have the time to describe in 15 minutes, which you probably don't care about anyway. To reduce exposure of the thyroid to any free radioactive iodine, 100 milligrams of iodine is administered a few days before the test. The non-radioactive iodine is given twice a day and again at least 1 hour before the radiopharmaceutical is injected. It's also given for 2 to 7 days afterward the test, depending on whether the I-123 or I-131 is used. As an alternative, the SNMMI's guideline suggests a single 100 milligram dose of iodide 1 hour before MIBG or DAT scan administration. And here's where it gets a little tricky. Lugol solution is commonly available in different potencies of 1% up to 15%, so you have to pay attention and know how much iodine is in each drop. 1% Lugol solution contains 25.3 milligrams iodide per ml, or about 20 drops per ml. SSKI has 1,000 milligrams per ml. The suggested pediatric dosing of potassium iodide is 65 milligrams a day for children 3 to 13 years old. The dose of potassium perchlorate is 40 milligrams and 60 milligrams for sodium perchlorate. Both are given at least 1 hour before radiopharmaceutical injection. Lugol's or SSKI should not be given to patients with active tuberculosis. Not that I've ever come across someone with active tuberculosis in 40 years of nuclear medicine. It should also not be given to people sensitive to iodine, and it should be discontinued if the patient develops a sensitivity. And here's why you should always read the package insert for anything we use in nuclear medicine. Large doses of Lugols may cause iodine poisoning. And for the record, they sell this on Amazon for $9 a bottle. Who knew? Also, if Lugol's is allowed to pool on the skin, it can cause iodine burns, which can be removed with alcohol. Again, who knew? The next drug is recombinant human thyroid stimulating hormone, or rh-TSH, or commercially it's called Thyrogen. Thyroid cancer traps iodine poorly, but it can be stimulated to be hungry for iodine by increasing TSH levels. To maximize the sensitivity of iodine whole body scans to identify residual thyroid tissue or metastasis, we stimulate TSH production to increase the avidity of the radionuclide. When imaging is performed immediately after thyroidectomy, thyroid hormone is usually withheld to allow for elevated endogenous TSH levels so we can image. For follow-up scans later, though, ongoing thyroid hormone replacement must be withdrawn because if you remember the thyroid feedback loop, when a patient is on replacement hormones, their T3 and T4 values should be at normal levels, therefore their body doesn't produce TSH. A serum TSH value of greater than 30 milliunits per ml is desirable prior to imaging. Usually this means patients must be off their hormone replacement for 4 to 6 weeks, which isn't pleasant and produces a wide range of symptoms similar to acute hypothyroidism. It can then take several weeks to months for the symptoms to subside after the patient resumes their thyroid replacement therapy. Thyrogen is a protein designed to be identical to endogenously produced TSH. It elevates TSH levels without the need for patients to stop their thyroid hormone replacement, avoiding thyroid hormone withdrawal. The dose of Thyrogen is 0.9 milligrams given intramuscularly in the buttocks 2 days in a row before radioactive iodine is administered. The radioactive iodine dose should be given 24 hours after the second injection. Thyrogen should not be given to patients who have not had a thyroidectomy or who do not have thyroid cancer with metastasis. Note, there have been reports of events that led to death in patients who had not had surgery to have their thyroid gland removed or without metastasis who were given Thyrogen. And as always, it should not be given to patients with known hypersensitivity to Thyrogen. Also, as a precaution, residual thyroid tissue after surgery and metastatic lesions can grow quickly and become painful after Thyrogen administration. Patients with cancer cells near their trachea, in their central nervous system, or in their lungs may need to be treated with glucocorticoids to help prevent an increase in the size of the cancer cells before Thyrogen administration. The adverse effects of Thyrogen include nausea, headache, fatigue, and vomiting. And on that happy note, let's turn to the last medication for this week, which are the lidocaine and lidocaine cream. Significant degree of pain is associated with the sulfur colloid injection for sentinel node injections because the skin is stretched from the injection and because sulfur colloid is acidic. Lidocaine significantly reduces this pain. But what exactly is lidocaine? Lidocaine is a local anesthetic that prevents pain by blocking nerve signals by inhibiting the sodium channels on nerve membranes. It essentially numbs an area where it's applied, preventing nerves from sending pain signals to the brain. What is EMLA cream, you ask? EMLA stands for Eutectic Mixture of Local Anesthetics. Now you should be asking yourself, what the heck does eutectic mean? Eutectic denotes a mixture of substances in fixed proportions that melt and solidify at a single specific temperature that is lower than the melting points of the separate constituents. EMLA cream is a topical, meaning applied to the skin, anesthetic cream that contains both lidocaine and prilocaine. What we're really talking about here is aspirin with lidocaine, or Bengay. Both lidocaine and EMLA cream are often used during lymphoscintigraphy for local pain analgesia. For lymphoscintigraphy, 1% lidocaine injected intradermally or between the layers of the skin at the site or sites where the sulfur colloid or lymphocyte will be administered. It can also be mixed in the syringe with the tracer itself. For EMLA cream, a thick layer is applied to intact skin and covered with a bandage 1 to 2 hours before the radiopharmaceutical injection. For lidocaine, again, the one contraindication is patients with a known sensitivity. Lidocaine should be used with caution in pediatric patients, especially less than 6 months of age, due to the medicine's potential toxicity. Along with the desired effects of lidocaine, there are some unwanted effects such as redness, edema, itching, and a rash. For EMLA cream, it should not be used on patients with a known sensitivity. All package inserts say this. It should also be used on intact skin. As a precaution, avoid contact in or near the eyes. Also, patients treated with EMLA cream should avoid inadvertent trauma. Have you ever had a tooth numbed by a dentist and then bit the inside of your cheek? That's what I'm talking about. Finally, the adverse effects of EMLA cream include redness of the skin, mild tingling or burning, swelling, and temporary changes in skin color. Alrighty, so there you have the third Pharmacy 15 reviewing medications used during endocrine and lymphatic nuclear medicine procedures. I provided an overview of Lugol solution, recombinant human thyroid stimulating hormone, rTSH or Thyrogen, and lidocaine and EMLA cream. Lugol solution is an iodine solution used to protect the thyroid gland from radioactive iodine during procedures like DAT scan imaging and MIBG scans. It works through a mass effect, saturating the thyroid with non-radioactive iodine to reduce radioactive iodine absorption. Various potencies of Lugol solution exist, and dosing depends on the specific procedure and patient. Thyrogen is used to stimulate the thyroid to uptake radioactive iodine for iodine whole body imaging by elevating TSH levels, which is particularly helpful for identifying residual thyroid tissue or thyroid cancer metastasis. It's given through intramuscular injections 2 days in a row before radioactive iodine is administered, and patients do not have to stop hormone replacement when this medication is used. Lidocaine and EMLA cream are local anesthetics used to reduce pain associated with injections during lymphoscintigraphy, especially injections of sulfur colloid. Now, take a moment to review your notes, review the summary document I uploaded to Moodle, and work on the flashcards. You should particularly focus on the timing and patient aspects of these medications. So, I'll see you, well, sort of, next time when we review the cardiac interventional medications like dipyridamole and adenosine. Let me know if you have any questions and keep studying.